Welcome to SafeFoodTest.com's Utah Food Handler Training and Exam. I hope you enjoy the class. SafeFoodTest.com is your trusted partner in food safety. Our mission is to protect consumers and ensuring that the highest standards of food safety is distributed across the entire food supply chain. We have a boat-to-throat mentality, a farm-to-fork, a tide-to-tongue mentality. Food safety begins at the source and continues through processing, transportation, and preparation. Food handlers are the front line of maintaining food safety, and their knowledge and understanding of food safety is critical. The numbers really tell the story. In the United States, there are over 15.5 million food handlers as of 2023. These food handlers prepare approximately 70 billion meals and snacks a year. This means that each food handler potentially has 4,500 lives in his or her hands annually. Given these numbers, it's pretty important that food handlers are knowledgeable and have understanding and, of course, well-trained about food safety. Well, what is food safety anyway? Well, food safety refers to the conditions and practices that preserve the quality of food to prevent contamination and foodborne illness. So what's foodborne illness? Foodborne illness, also known as food poisoning, occurs when you ingest contaminated food or drink. This contamination can result from pathogens like bacteria, viruses, and parasites, or chemicals. Symptoms typically include nausea, vomiting, diarrhea, abdominal pain, and sometimes fever, and they can vary in severity. Simply put, a foodborne illness is a disease transmitted to people through the food. So it's important you know the causes of foodborne illness. There's different categories. There's biological, chemical, and physical. In the biological area, we're concerned with things like bacteria and viruses and parasites. And then when you get specific with bacteria, we're talking about things like Salmonella, E. coli, Listeria. And when we talk about viruses, it's things like norovirus and hepatitis A. And with parasites, there's hundreds of different kinds, but things like cyclospora or cryptosporidium. So, chemical, that's things like additives, allergens, maybe sanitizers, cleaning compounds, toxic metals, and pesticides. And there's others too. But we got to think about things like nitrates and sulfites. And is the food an allergen like a fish or a crustacean or a tree nut or a peanut? Are we using things like chlorine, quartz, or iodine, and we're using them the proper concentration? And could our supply chain have improper use of pesticides or other maybe industrial chemicals that are in the area? And last but not least, we have things that are physical, like hard, sharp objects. Some that are natural and inherent to the food, some that are not. We have to be mindful of things like bones and pits and hair and shells. So we know what causes foodborne illness. We know what foodborne illness is. We need to know what are the major contributing risk factors. In this class, this training, is meant to address these specific areas. One of the areas of concern is unapproved suppliers. We'll be covering that in Section A. Another area is inadequate cooking, Section B. Improper holding and storage, Section A. Contaminated equipment, Section C. And poor personal hygiene, Section D. According to the CDC, these 5 factors are the major risk factors causing foodborne illness. American consumers seek a safe, diverse, and abundant food supply that is simultaneously affordable and available throughout the year. To help meet these consumer demands, the United States imports about 15% of its overall food supply. Today, more than 200 countries or territories and roughly 125,000 food facilities, plus farms, supply about 32% of the fresh vegetables, 55% of the fresh fruit, and 94% of the seafood that Americans consume annually. I think it's important as food handlers we know where our food is coming from. But don't you worry, our country has shifted its approach to food safety from reactive to proactive, beginning with the signing of the Food Safety Modernization Act, FSMA, by President Obama on January 4th, 2011. However, this was only the start. The U.S. Food and Drug Administration continues to implement new regulations and guidelines, such as the new era of Smarter Food Safety Blueprint introduced in July of 2020. This initiative emphasizes modern technologies and real-time data to improve food safety practices. Training like this one continue to grow throughout the country, helping aid in food safety initiatives. The Utah Department of Health and Human Services requires all food handlers to obtain a permit from a local health department before they are allowed to handle food which will be served to the public. In order to receive the permit from the local health department, a food handler applicant must take a course like this one offered by an approved food handler training provider, pass the exam, and receive a certificate from the training provider they have taken the course and successfully passed the exam. The local health department will not issue a food handler permit without receiving documentation of this certificate. It's our job. As food handlers, it's our job to protect the public. We are the front line of food safety. As food handlers, it's our responsibility to provide safe and wholesome meals to our customers. At SafeFoodTest.com, we understand the challenges involved and hope this training and exam will help equip you with the tools you need to excel in your role. Most importantly, our goal is to teach you how to deliver safe food to your customers. Additionally, we want you to successfully pass our 40-question online assessment, which requires a score of 75% or higher, at least 30 correct. Let's take a look at the course outline. So you just about finished the introduction. We're going to be moving into Section A, limiting harmful pathogens, followed by Section B, destroying harmful pathogens and preventing food contamination. Section C, equipment, utensils, and linens. Section D, employee health and hygiene, followed by a 40-question exam.